Welcome back. Botox is becoming more and more popular, so our Brogan Morris went to talk with a plastic surgeon to find out the pros and cons of this procedure.
And she explains that it can be used for more than just aesthetic purposes.
Hey friends, it's Brogan with What's Good For You. Today I'm here with Dr. Edward Davidson, who specializes in plastic surgery. And today we're going to talk about what you guys might know as Botox, but that's actually just a brand name for
neurotoxins, a family of medications that include Botox that can either relax a muscle or relax a gland.
And see, I just learned that today. So he's teaching us all kinds of things today. So first, Botox can be used for, of course, aesthetic things, but what else can it be used for?
So any muscle or any gland, you can relax it using Botox and similar agents. So yes, we think of the muscles in the face that can create wrinkles, but then there's also glands in the armpits that create sweating, so people use it for hyperhidrosis to get rid of that, and then a multitude of other different muscles and glands in the bodies that all aspects of medicine are using Botox and other products for.
So what kinds of pros and cons go with this?
For the aesthetic side of things, I think Botox is really a fantastic part of any maintenance regimen to ensure that we're aging well as part of facial rejuvenation. So typically it's going to target muscles in the upper third of the face, so the horizontal lines of the forehead, the sort of 11s or the angry sort of lines in between the eyebrows, what's called the crow's feet at the side of the eyes, and then actually as well sometimes some of the lines or the banding in the neck can be softened with Botox too. I think so that the main advantages of it, it really will soften those lines and give a natural, smooth appearance. The main disadvantage of it is that it doesn't last forever, and you have to do it regularly every 3 or 4 months or so.
And are there any dangers that go along with it?
So Botox has been around for a long time, so we know that it's safe, assuming that it's used within those indicated areas. There are some medical conditions that would contraindicate you having Botox, so it's important to check with your provider before having that. There's also certain allergies that would prohibit you from having Botox. And then other risks are if Botox can migrate and move and get in the wrong place, it can cause things like lid drooping or eyebrow drooping, which is obviously not ideal.
Yes, and I have seen that before. So in the case like that, is it reversible? How would you fix that?
Well, the advantage of it, if that happens, worst case scenario is it's going to wear off in that 3 to 4 months anyway, but you can speed up that process with lids that are droopy, with some eye drops that can help. Don't completely get rid of it, but can help. I think obviously prevention is better than cure, so making sure it's done the right way the first time.
Yeah, so maybe not an at-home Botox kit.
I would not I don't even know if that's a thing, but I would not recommend an at-home Botox kit. No.
Good to know. Okay. Is there anything else about Botox that you want to say that I have not already asked you?
I think, one of the things you hear people talking about a lot is, preventative Botox, and that hasn't been completely borne out in the evidence. I think, in timing of it, when should you start getting Botox? I think, definitely when you start seeing lines at rest, those horizontal lines being there permanently, that's definitely a good time to really start thinking about getting Botox. But, preventative Botox, I think is still something that needs to be fully proven as beneficial.
Okay, so do I need it yet?
You don't need it, but you do have some permanent lines at rest there. Yeah.
Oh my God, yeah. That's it, you're fired. Okay guys, we're gonna
We can do it right now. We can do it right now.
Okay y'all, that's what's good for you.